my name is Paula Joya, and I will be talking about today's discussion regarding mental illness and medication. What is normal? What is crazy? How do you define mental illness? Normal is often defined as the ability to function within societal norms without disrupting the social structure, as we were speaking the last time in class. And on the other hand, someone labeled as crazy is often seen as crossing those boundaries in a way that disrupts the environment. However, these definitions are subjective to shape by culture and time. In class, we gave the example that 50 years ago, crazy is not the same that we see today, crazy, and the same for normal. So that pretty much qualifies. Mental illness, in contrast, is a clinical condition affecting mood, thinking, or behavior, impairing daily life. It is not just about breaking social norms, but about the impact on a person's well being and ability to function. What can we do to reduce the stigma of mental illness? To reduce stigma, we must increase awareness and empathy. Education is a huge key. When people understand that mental illness is, they are less likely to judge. Social media has played a major role in spreading awareness and allowing those with lived experience to share their stories. As well, media representing matters. Accurate portrayals of mental illness in movies, books, or shows can challenge stereotypes. Lastly, policy changes such as workplace protection and accessibility to healthcare can normalize the conversation about mental illness. Should we give medicine to treat mental illness? If so, for which ones? For what age? How do we feel about medicine versus therapy? Yes, when necessary. Severe mental illness like schizophrenia, bipolar disorder, and severe depression often requires medication. Decision depends on the individual, the condition, and its severity. Which illness? Conditions with biological components such as schizophrenia, major depression, and disorder often need medications and others. What age? Children and adolescents can be prescribed medication, but it should be done carefully due to brain development in adults under the supervision of a professional. Medication and therapy are not mutually exclusive. Therapy, like cognitive behavioral therapy (CBT), helps people develop coping skills, while medications stabilize symptoms. And it's also great when they mix therapy and the medication. In my experience, I've tried to keep going to therapy to get off the medication, at some point be able to regulate myself and develop those skills. Do we overdiagnose mental illness and explain? Do we overmedicate for mental illness and explain? Some argue that mental illness is overdiagnosed due to increased awareness and border diagnosed criteria. For example, ADHD diagnoses have risen, some see have improved detection, when others worry about medicating normal childhood behavior. Overmedicating is also a concern, especially conditions like anxiety and ADHD medication is sometimes prescribed without first exploring therapy or lifestyle changes. However, under medication is also a problem. Many people avoid necessary treatment due to the stigma, which is, of course, not great. The key is individualizing care. Medication should use when truly needed, but therapy and other investigations should also be considered. And at the end of the day, as long as you've been advised by a professional and you're going to your therapy sessions and you're taking your medication as needed, it should be all right. And as well, the stigma, I personally feel like everything has evolved in a couple of years. Everything should be more normalized as we go further. Of course, we always have the people who will say, oh, I have depression, I have ADHD, because of trends and do not treat it as actual illnesses or disabilities. I've also seen with autism, but I do expect in further years to society to have a further understanding about these disabilities and illnesses. And thank you.